say that the state of Minnesota runs on the state fiscal year, so it ends in is it July 1st, end of June, beginning of July. So these are statistics from last year. We had 91 open cases and 106 kiddos on that caseload. Our collections on arrears measure is up from 67.5% to 70.5%, and that is anytime we collect $1 of arrears in any given month for any past case, that counts towards that. So it's not a dollar for dollar. It's not like we were owed $10,000 and we collected $7,000. It was just on any one of those cases, if we collected anything, that counts towards that measure. Secondly, our paternities established measure increased to 116.13%. Now this is confusing. How can it be over 100%, right? So it takes the previous year's kiddos that we have on our caseload and any of them that were not married at birth. So if a child is married to a mom and a dad, or child is born to a married mom and a dad, that child is automatically legally their child. Child support didn't have to do any work on that, so we don't get credit for that. Any ones that we do get them to sign a recognition of parentage, or we bring them into a court and we adjudicate parentage, we get credit for those. So it's this last year's number over the previous year's number, and that's why our numerator was bigger than our denominator, and we have 116%. We are the second highest in the entire state on that measure out of 87 counties, so we're really proud of that one. As proud as I am of that, I do want to temper it in saying a lot of that is outside of our control. We can't make kids be married or be born to non-married parents or vice versa. So a lot of it's outside of our control, but it does show that we are establishing paternity on all the cases that we can. Our orders established, and that is just making sure that we have a support order on our cases, is at 86.53%. We are above the state average there. And our collections on current support decreased from 80.84%, decreased to 80.84%. Now, I was in a meeting with Kristen, and I think we were the fourth highest collecting county last year, and you said, what would it take to get to first? Unfortunately, we dropped to seventh, but I still feel really good that we are in the top 10 we're in the top 7 of the entire 87 counties on that measure. And so what that is when support is due in a month, we are collecting it in that month, and that is a dollar for dollar. So we collect 80% of all money that is due in any given month in that given month. We dispersed $218,000 in 2025 for kiddos on the Cook County child support caseload. So those are stats and figures. Those were fun. I mentioned this last year, so here's just what's going on in the world of child support. We finally implemented iPay online. So it used to be where there was only a few ways you could pay your child support. You could walk into an office and write a check. You could mail your check into the child support payment center, or you could come in with cash, and accounting would figure out how to receipt a check down to the state. Or your payments would come directly from your employer. That's the most common way. But now we can take e-checks, debit or credit cards, and e-wallets such as PayPal, Apple Pay, Google Pay, and Venmo, etc. I feel like I was an advertisement for them right there. We're unsure how good that is going to work. There's no way to measure it on a month-by-month basis. So at this time next year, I'll be able to tell you, we dispersed $218,000, and of which, $20,000 came from e-checks or debit cards. So right now we don't know how that's going to work, but I can't imagine it can't hurt, right? I think we're in the world now where that's how most people pay their bills. I have one bill I still have to write a check for every month, but everything else is either automated or I, jump in and put my debit or credit card information in there. So now we can take child support payments that way. Minnesota is only one of 4 states who still automatically run a cost of living increase for our obligors. Ramsey County, they have a bunch of people who work directly on legislative matters. They are looking at repealing that statute language in the next legislative session. It was actually on the docket for this one, but it was pulled. I don't understand all the legalities of why it was pulled, but it was pulled. But it's going to be on the docket for next session. And so right now, every 3 years, your child support automatically goes up based on cost of living. And again, we're one of only 4 states that still do that, because that's not the reality of a lot of people's, actual jobs. They didn't really get the 4% raises every year for the last 3 years. We know cost of living is high right now. That doesn't mean that obligors necessarily should automatically have to pay more. What it does do, though, is they're leaving the statutory language that we have to review those cases, and so we'll take a case-by-case basis on all of those cases every 3 years to see if they should go up. And if they should go up, we'll start a modification, we'll bring it into court, and we'll get those modified. The Americans with Disabilities Act provisions have directly impacted a lot of child support court filings. So we now must ensure that our court orders are fully accessible by April 24th of 2027. They gave us another year because we were not going to make it in time. Our statewide child support system doesn't easily allow this. We have an antiquated, I've mentioned this before too, it's a DOS-based system from the 1990s. I think it was built in 1996. It's written in what's called natural coding, and down at the state they had said there's about a dozen people who even know how to code that anymore, and those people aren't going to be around forever, so we have to have a new system. I think it was $23 to $28 million, I always forget the number, a few years ago was actually earmarked for us to upgrade, for the state to upgrade the PRISM system, and because of the way government works, it's taken its time, and we've been trying to figure out what that's going to look like, what the system's going to look like. The look and the feel of this DOS-based system, if you've ever been in DOS, when you get good at it, you can move really quickly through it. Tabbing and typing and tabbing and entering and putting a P here and tabbing and entering, you can move really quickly without ever needing to use a mouse to go up here and click. But our workforce, the newer workforce, is not used to those type of systems. They're used to Microsoft-based systems, SharePoint systems where you can go in and you can double click something, enter your information, go over here, double click something else, enter your information. So again, we're not exactly sure what it's going to look like, what the look and the feel of it is going to be. But again, we've got tens of millions of dollars, so something is going to be changing soon. But back to the Americans with Disabilities Act, because I went off on a tangent there. The state has created Microsoft Word templates for our court orders. That makes it much more labor intensive. No court order is exactly the same. You might need to put a paragraph in explaining, a non-custodial parent's situation, a custodial parent situation, living arrangement situations. There are hundreds of paragraphs that these templates are automatically built with, and staff have to go through and pull out the 100 that they don't need and add the 10 extra ones that they do need. Right now it's creating about an hour more of work on every court order that we do. So it is very labor intensive. And those are only a few of the examples of the why child support is becoming more difficult. There are fewer and fewer cases where parents were married, had a kiddo, got divorced, and then we get a child support case where we have to enforce it, and it's just easy as that. There's more cases where we have to locate parents. We have a more transient clientele. We now have multi-state cases in Cook County with Michigan, Iowa, Wisconsin, Ohio, Washington, Missouri, Arizona, Maine, and Indiana. So those are the other states that we're currently working with on our caseloads. And so that takes a lot of work too. Not every state has a worker where you call a number and you get a worker. Some states are run differently where you call a call center that's just based in the capital city or the biggest city, and you wait on hold and you get somebody who you hope knows enough to tell you what's going on with that case. So staff sometimes spend 45 minutes to an hour on hold waiting for to get a hold of somebody. I was going to throw Texas under the bus here right now, and I am going to throw Texas under the bus, but we don't have any Texas cases in Cook County, so we're okay for Cook County. In Carlton, we have Texas cases, and Texas runs that way. It's really hard to get a hold of somebody in Texas. And then sometimes you have to leave a message and just hope they get back to you within a couple of days. Along with the Americans with Disabilities Act work that I had already mentioned, we've been tasked with e-filing our own paperwork. Now, this happened a handful of years ago, but I'm just adding it to this list. Court administration used to do that. We would email over or walk over paperwork to court administration, and they would take care of all the rest of it. Now we have to e-file everything on our own. We have to do intensive safety searches on all of our cases. Super important. We want to make sure that there's no, restraining orders or harassment orders or anything out there before we start mailing out paperwork with addresses on there. But again, that is intensive. We have to look through the MGA system to look for all of those types of orders. Before we suspend a driver's license now, that statute changed. There's 11 different reasons to not suspend a driver's license, so it used to automatically happen. If somebody met criteria, that information was sent over to DPS. DPS would do what they needed to do. They'd send us, the information back that, hey, this license is suspended, and then it would be done. Now there's a whole bunch of review that has to go into it, again, for these 11 different reasons that we may or may not suspend that driver's license. And I've also taken on a few different roles over the last handful of years. I'm on the Child Support Advisory Council. I represent the 13 county region up here, putting me at the forefront of some important decision making at a statewide level. And because we have a 2-county partnership, I was also asked to be on the pilot project for increasing our collections on current support. I partially think it's because Cook County was the 4th highest collecting county, and then secondly because I work in 2 different counties, and so they thought, there could be something to be gleaned from the type of work we're doing, as a region. I think we have at least a few ideas that are going to help us out with that collections on current metric, but just like the online payments, I'm not 100% sure. I can flip a lever right now, but I won't know if that actually did anything until I can check the data about a year from now to see if that actually increased our collections at all. And that is all I have for you today. See, I talk fast.
Way. Thank you.
Yeah, you bet.
Always a pleasure to have you here. I bet you we have some questions. Commissioner Gamble.
Thank you, Mr. Chair. And thank you, Dan. Appreciate it. Analytics are beneficial to the extent that they inform how we conduct business moving forward. So when you look at it, you're able to evaluate effectiveness and stewardship responsibility. You referenced early that I think we were in the 4th or 7th position, and I may be connecting this to something that that's the wrong figure, but you said that's not from anything that we've done. Do you recall in that comment that you said we're in this category? And was that the one you said, what would it take to get to first?
So those are 2 different. We're at 116% of our paternity establishment, and that's the one where I wanted to temper that a little bit because, again, we can't control if children are born to married parents or not.
That's right.
Elections on current one, I feel very confident that it is because of the work that we're doing, that if somebody calls us, we pick up our phone, immediately or call people back almost immediately. I didn't mean to jump over you, so I apologize.
Yeah.
2 different figures.
And what that, for me in hearing that is that while the figure, if we say it's nothing we can do, that analyzing and understanding from the context of saying, what is it about this region or this area that makes that conducive? And let's just say that if you look at farming, there are areas that are conducive to raising this at a lot more bushels than you're going to get over here, just because of the culture, the environment of the area that you find yourself in. So it doesn't mean that numbers can't tell you something. It just, again, what do you do? But the other comment was 4th highest collecting in the county. Is that related to our process of getting things done on a timely basis, or is that related to a dollar figure?
So that's a dollar figure. So we went from 4th to 7th. That's the one where I told Kristen I wanted to move us up to 1st, but I couldn't get us there. We actually dropped a little bit. So that's dollar for dollar. So when we dispersed $218,000, I can't do the math really quickly, but that was only 80% of what we could have dispersed, right? So whatever that is, add 20% to that,
yeah.
And that's what it is. 200,000 of 250,000 or whatever is what we dispersed.
And if you're just listening and you don't have a context to understand this, when you say 4th highest collecting in the county out of the 87 counties, you could interpret that to mean that it's the amount of revenue we're getting, but it isn't. It's of the available or those that potentially we can collect, that we are doing a good job of getting that, and that's what puts us in the 4th position, is because we're getting a large percent of what we can get because of our timely filing on those things.
Correct. Yeah, it's not a revenue. It's our disbursements to
right.
parents to then the families
yeah.
and the kiddos.
And so, like I say, analytics is beneficial when you understand it in context and you know what you can do to try to change that.
Yeah.
But to staff and people that are responsible in this particular area, that's very affirming when you see that kind of productivity and commitment to what you're doing. How many years have you been in the position?
Right about when 2015, so right about when we took over the Cook County contract. We had it for 1 year, and then I took over as the supervisor.
And what is the most significant change you would say that affects that department over that period of time?
That's a really good question. I think I'd have to think.
Only one.
Right. Boy, I don't know. Good question. I think, you see, it changes. I think it's keeping up with the legal changes that change every year. So the state has used this terminology. We have become kinder and gentler. So the child support of when I started was, if there were birthing expenses, automatically the non-custodial parent was going to have those added to their arrears balance immediately, right? So that could be $4,000 to $10,000 immediately. And so that put non-custodial parents kind of behind immediately, instead of saying, wait a minute, potentially I didn't even know this child was mine. I didn't know how much this was going to cost. I could have planned for this, whatever it may be. That went away 10 plus years ago. The driver's license suspension, again, a lot of these things that used to just automatically happen no longer happen. We have what's called good cause to not have a child support case. So when you get on medical or cash assistance and you have a child and the other parent is not in the household with you, a referral automatically happens to child support, because the state says, let's find who that other parent is, that non-custodial parent, and let's have them potentially pay a little bit of something towards this cash or medical assistance that we're given for this kiddo. But there are reasons why that shouldn't happen. Maybe you fear, for your safety to have that other person involved. So good cause, and I think that last time I came here, actually, I talked about this. Good cause has become more broad now, where you don't need to prove to me that you're afraid. What would you give me that would prove to me that you're afraid? You telling me you're afraid should be enough. I should believe you, and not have to have you have a restraining order against somebody or court, a police report on somebody. And so kinder and gentler helps out in many ways, I think, for participants. Makes our job just a little bit more difficult in figuring out what to do on cases and to analyze cases a little bit more. So I think, but again, that's not one thing, that's many things. Sorry, Commissioner Mills. But I think that ebbs and flows with many different things.
I was joking.
I'm glad.
And when I hear kinder and gentler, I think that's a good description. I also think it's smarter, because we know a lot more about people and society and how things work, or what does or does not work. And it's a very, very complex system and many complex situations. And so I feel like what we have learned through evidence is to take that approach, and that brings better results. So, but that's just my editorial.
No, I agree. Going back to if you added $10,000 in arrears to somebody's case who's a 22-year-old kid with a part-time job or something, right? He or she, the non-custodial parent immediately is, just again behind the eight ball and trying to get all of that caught up and get their life figured out. And they're a young person, right? Exactly. Yeah. Good luck in trying to do that. And so the evidence, the data, the analytics had shown that those weren't getting paid, or those people were then not taking jobs, taking cash jobs, getting paid under the table, not making those payments. We were writing off these payments sometimes,
bringing
because
everyone
these payments
down.
Right. Yep. Yeah. Collections were low. These payments usually weren't owed to the custodial parent who paid for it. They were owed to medical assistants who had paid for the birth of that child most often. And so then we would just write those off. We have a write-off policy. So 6 years go by or whatever the cutoff is, and no payments come in on that, we write it off anyway. So then it was just a bunch of work for nothing.
Right, and then we all pay if it's MA. Yeah.
Right.
Administrator Treble.
Thank you. So first of all, Dan, I want to say thank you for your work, and I'm glad we're still in the top 10.
Yeah.
So we're still doing great.
Yes.
So, but it is incredible, the work that you have done with this group. So thank you for that. I do have a question about, you mentioned the modifications every 3 years.
Yeah.
Does that have a staffing impact? Meaning, so if that was automatic through the COLAs every year, and now your staff have to review those every 3 years, are you anticipating that is going to mean you may have to hire additional staff, or what does that do to your current workload?
I don't think so. I could see that happening in much, much bigger counties than Carleton. It's for sure Cook. It's not going to be a staffing impact for the 1.0 that is in our contract right now. I don't anticipate that would be a staffing impact for us as well. I don't know all the ins and outs of it yet, because it hasn't happened yet. We haven't actually repealed the COLA statute yet, so the automatic, every 3 years yet. I imagine there's going to be some training from the state on what needs to be reviewed on those cases. What did employment look like? What does it look like now, right? How much did they make? How much do they make now? Minnesota takes both parents' income and it goes into a calculator. It's not terribly difficult. There is some analyzing that has to be done on, maybe they work part-time, but they could work full-time and have to impute a little bit of income. There is some figuring that needs to be done. But no, sorry to make a question longer, or an answer longer than it needed to be, but I don't think it'll affect staffing.
Okay, thank you.
You bet.
Frank, yeah, I saw your hand, and then Commissioner Gamble after that. And we can't see Frank right now.
Yeah,
Oh, okay, you're on it. That's fine.
Get
Go ahead, Frank, we can hear.
everything to pop up there.
Okay, trying to get my video back on too. Okay, question for you. I understand the collections for last year were about 218,000, and that's great. Tell me, who pays for this? Is this something that's added on from the person paying child support? Is the county reimbursed? Does Cook County reimburse Carlton for this? And how much is that? How much did it cost us to collect 218,000?
So who's paying for the 218? Is that the first question?
Who is paying for the cost of collecting
Oh.
child support? I don't know how that works. I'm sorry.
Yep, we have a contract with Cook County. It's $139,000, I believe, per year. Right now, we haven't negotiated for next year yet. Again, cost of living is increasing. Our, staff are going to get wage increases, I hope, and cost of healthcare increases, continue to happen. I mean, I wish those didn't happen. And then those are 66% reimbursed from the feds. So child support is a federal program that is 66% reimbursed. So I'm not your accountant on this level, but I'm guessing all the costs included in that contract get submitted to the state for 66% reimbursement. Sorry, I think Grace, you might have been saying
Yeah,
something.
that sounds correct to me.
Okay.
Did you catch all that, Frank?
Yeah, so basically Cook County is paying $45,000 to collect $218,000 for our citizens. That's not a bad deal. I'll take a 4 for 1.
Thank you. Any other questions right now? I'll pass it to Commissioner Gamble.
Yeah, thank you, Mr. Chair. Thank you. Really appreciate your work, and you exude confidence that comes through your experience. Even though you're feeling a little under the weather, it must be what you're drinking. But my question is, given the leadership positions that you find yourself in, representing, collective groups and things like that, what's your experience, given what you learned through your lived experience, in trying to get leadership that enables change to take place? Do you feel that you're being heard, or do you feel that very frustrated because of the opportunities we have to improve, but those that can help us do that aren't listening?
Yeah, that's another really good question. I think it's somewhere in between. I feel heard, but I still feel like there are things that can't be done. I mean, there are budgetary constraints, obviously, at the statewide level. I could have all the best ideas in the world to build a new computer system that will work and do everything that we need it to do with automated payments and, again, the iPay online, but I don't get to spend tens to hundreds of millions of dollars at the statewide level to get that to actually happen. So I think the group, the Child Support Advisory Group, so this is going to be my third. The election is this month, actually. This will be I'm running unopposed, so I'll be on the commission again. This will be my third go-round with it. I think there are a lot of, I'm talking in a circle here. I think there are a lot of really good ideas, and there's only so much that we can actually do. We do get 66% reimbursement from the feds, but the feds are very hawkish on making sure that we spend that money correctly. The state of New York built a system that they thought was going to be approved by the feds, and then the feds said no. And so, they spent, let's say, $100 million and thought they were going to get 60 of it back, and the feds said, nope, this isn't going to work for what we would have approved. And so they don't.
When was that?
Get that.
Do you know?
Yeah, not too long before we got ours approved. So, because that's why, that's the reasoning before we got our money, the $28 million approved. It's the reason that we're being given on why it's taking so long, is we are, and I think appropriately so, taking every step as a baby step to make sure, we're going to change the coding on the back end, send it to the feds, make sure the feds are okay with that, right? We are going to make it look this way and feel this way because we think that, the new up and coming college grads who are going to be child support workers someday feel more comfortable in it, send it to the feds, make sure the feds make sure that they think it's okay to make sure that all gets approved. So I kind of tongue-in-cheek said it's the way government works. Government doesn't always work slowly, but in this case it is working very slowly. It's taking years to get a new system. I know system modernization is on the forefront of a lot of a lot of different systems that are happening, and ours is just another one of those. And the staff down at the Minnesota IT staff, they only have so many resources as well. So I don't know how many people they can put towards this and how many hundreds of hours this is going to take. So sorry to go back to your question, Commissioner Gamble. I think I'm heard. I think there's only so much that can be done. A lot of the changes that I've mentioned over the last handful of years, including the ones today, a lot of those have come from that Child Support Advisory Group. The state used to, again, more so before I was even on the Child Support Advisory Commission, used to make changes, and we would only become aware of it through a bulletin, right? A bulletin would come out and say, here's the change, and now you have to start doing this, and we'd say, what? Nobody's talked to us about this. We didn't know this was happening. So at least now those conversations, even if something is statutorily changing and we have to do something, at least the conversation happens like during the legislative session, so we have an idea of, hey, 6 months from now you're going to have to start doing something a little bit differently. So I appreciate that portion of it. Yeah.
Thank you.
All right, any other questions? Yeah,
Just
Administrator Trotter.
one quick question, actually, two quick questions. When you talk about the federal reimbursement, are you talking about Title 4E reimbursement?
We're 4D reimbursement.
4D, okay, thank you.
Title
And then,
4D, yep.
Are there any magistrates on the advisory commission?
There are not. This is our group.
It's just all
there are
county
other
social
groups
services?
with magistrates on them. Yeah, we have a group
Okay.
called MFSRC, which is the Minnesota Families Services Recovery Council or something like that. Sorry, I'm blanking on it. They
Sounds
meet
right.
they meet multiple times, but there's one big conference every year. There are magistrates who go to that, including the chief magistrate, whose name escapes me right now. Anyway, they come, county attorneys come to those meetings, to try to get some of that higher level information. At the end of the day, the child support workers are still the ones who write these orders. They're all reviewed by the county attorney's office and signed off on, right, to make sure we still work under the legal purview of the county attorney's office, but a lot of the work comes from the child support officers to begin with. And then if the magistrates, sorry to take your question further, again, when the magistrates have issues with certain things, they're sure to reach out to us, or give us a notice of deficiency on something and say, hey, I don't want you to write this way. This isn't the way I read the statute. Let's do it this way instead. And so that's kind of how we converse with the magistrates and get things done legally.
Okay, great, thank
Yeah,
you.
you bet.
Thank you so much for being here
Yeah,
this
you
morning,
bet.
Dan, and thank you for all the work that you and your team do on behalf of Cook County.
Thank you. Yeah,
Thank you, Dan.
you bet.
Thank you.
See you
Appreciate
next
your
year.
work. And thanks for your voice on the advisory.
Yeah.
Yeah, you bet. I enjoy it. Thanks.
All right, we'll move on down to our next item, which is summer preparedness presentation with Avi and Andrea. Morning, guys.
Morning. So, how are y'all doing this morning?
Good.
Morning.
Good. Y'all excited about the summer?
Yes.
It's nice out, right?
It
It's
was a-
feeling great. I mean, I've always feel like for me, summer is such a lovely time to look at because I don't have to worry about slipping. That's like my biggest thing. I'm so clumsy.
Beware
It's-
the mud, Avi. Beware the mud.
My wife got me hiking shoes so I don't die, which I think is really nice. But that being said, that's her version of preparedness. I think our version of preparedness is a little bit different.
Excuse me, this is Frank. Could we possibly get a microphone closer to Avi?
Yes.
Yep, I can.
hear about every third
Oh,
word.
Yeah.
there you go. Can you hear me now?
Much better, thank you.
Do you remember those commercials?
Oh, yeah.
Those were fun. Hate that they stopped doing those.
Yeah.
Great. So I think our version of preparedness is a little bit different for you today. So today we'll be going to be talking about summer preparedness, especially talking about wildfires, smokes, and my personal favorite thing to talk about, which is tick prevention. So I'm going to go ahead and hand this over to Andrea to go ahead and talk about wildfires first, right? Mm-hmm. There you go.
Good morning.
Morning.
As you might have noticed, this past Friday at the News Herald, we published an article that we usually do in summertime to kind of prepare, give education about summer preparedness from public health. So what we are focusing on, and what we try to highlight in the article is that summers in the North Shore bring long days and outdoor recreation, but they also come with the seasonal health risk, right? Like wildfires, poor air quality, tick-borne diseases, and these also are risks that are becoming more common due to our higher temperatures and prolonged dry spells that we've been facing in the last few years. So regarding to wildfire preparedness, what we like to highlight is that the summer wildfire risk is in Cook County is usually high as of right now. We are at not as extreme wildfire risk, but every time that it rains, it helps. However, we try to focus the education regarding to make sure the households have prepared go bags, that they sign up for code red alerts through the Cook County Sheriff's Office to receive emergency notifications, including evacuation notices, and to stay informed via trusted local sources. And what we highlight in the county is WTIP Community Radio. They are our partners to communicate to the public when complex situations are happening and the information needs to travel fast and to in ways that our community is used to finding those news. So we also highlight that in the event of evacuation, the sheriff's office is the one that issues that order, and then they also do a physical notice. So they go door to door along with the fire departments for the area that is getting evacuated. Then connected to wildfire, but this is more connected to poor air quality that comes with the wildfire smoke events that we have had experience in the past few years. The science and the studies are showing that it's likely that we will continue to experience these poor air quality days based on the risk of fire in Canada, because that smoke comes from fires that are happening far away from here that we really don't have control over. So what we can do is prepare our community to have strategies how to mitigate the impact of those poor air quality days. In the statistics that the MPCA showed in the last emergency services conference is that Cook County actually has been one of the counties mostly affected by these air quality alerts. And we have reached the, what you can see in your desk, we have reached the dark purple color when we have had those events. So it's important that people know what to do. There are some information that they can be found when you look at the website, but mainly we encourage to figure it out how to have a break from that poor air quality and consider a clean air room in the home. They can do that with a box fan, kind of like a do-it-yourself project, or you can get air purifiers to create that space and then have it as a resource when this poor air quality happens. It mostly affects children and pregnant women and older adults and people with underlying health conditions. But when it reaches the levels, red, purple, and the dark red, it affects everyone. All right, now I'm gonna let the tick-borne disease conversation.
Who here likes to hike? Yeah. Okay, that's great. I recently just discovered hiking because my wife likes it, and I want to make her happy. So
It's on the record now, you realize.
she knows it. Well, something to look out for when it comes to hiking is bugs. Obviously, we are all very irritated with the mosquitoes and the gnats that are just, everywhere. Our screen door just looks like, a scene where, like, the villain, like, throws their darts at, like, a board. Just, like, these bugs just sticking out there. But something to really look out for is ticks. So there are two types of ticks commonly found in Minnesota. Andrea handed you a card. The ticks are on this card, and they are two sizes. The two types are the black-legged tick or deer tick, or the dog tick, or otherwise known as the wood tick. Wood ticks are a little bigger. They're a little bit of a lighter shade of brown. The deer ticks are a little smaller and darker in color. You've all probably heard of Lyme disease. Those are usually carried by the deer ticks. The dog ticks carry other things. I'll get to that in a minute. If you get bitten by a tick, the most important thing that you can do is remove it gently. Okay, don't yank it off. Don't smother it in petroleum jelly. I guess that's a thing people do. No, just take a tweezer or take your fingers if you really have to and go ahead and squeeze as close to the skin as possible and gently pull off. You do that because if you tear off their head or if you just tear out the jaws, then it is still going to be in contact with your skin. The saliva is still going to be there and the risk of infection is higher. If you take it out, then that means that you've got the tick off your skin, which is the point of it. Something that you can do to decrease your risk of tick-borne illnesses is to treat your clothing with stuff like permethrin. You can use repellents, or you could just wear long sleeve clothes. That really tends to help. Make sure that if you go on a hike afterwards, you check your clothes and you wash them in high heat if you are in an area where there might be a lot of ticks. Not all ticks carry diseases, but if the infection occurs, symptoms usually develop 1 month after the bite. Lyme disease starts out like flu-like symptoms, and sometimes you'll see the red ring or bullseye mark where the tick bit you. So if you see any of those symptoms, you want to contact your healthcare provider. They will most likely start you on a medication called deoxycycline. That will help get rid of the infection if caught soon enough. The most important thing that you can do is try and get it caught early. Now, just because a tick doesn't have Lyme disease doesn't mean that it might not carry something else. They tend to like to carry diseases, these little guys. So, the black-legged ticks can also carry something called You want to do it? Anaplasmosis. Anaplasmosis and babesiosis, which is just super fun. Thankfully, the dog ticks have much more fun names to pronounce, which is Rocky Spotted Mountain Fever. Granted, that's not very common in Minnesota. You're most likely going to find that in places like North and South Carolina. But they can also carry stuff like tularemia and tick paralysis. So if you get bitten by a tick, keep an eye out for symptoms. If you get any symptoms, contact your health provider. These nifty little cards will tell you the do's and don'ts when it comes to tick prevention and getting rid of ticks. I recommend you follow them, but if you ever have any questions, you can always contact your local public health experts.
We also have these materials available for the public in our office. So if you're looking to have materials for your organization or a part of the community, you can get in touch with Andrea, and she has access to those through the Department of Health.
Right. Do we still have a tick drop at the clinic? Do we know?
Well, no, they don't have that right now.
I don't believe so,
Okay.
but that was a service that Grand Portage was providing, and they had the clinic listed as a site. I can check with Grand Portage Health Services and report back in July.
Thank you. They had some really interesting findings regarding percentage of ticks, percentage of different ticks with different diseases, with the deer tick, the black-legged tick being the most dangerous. I mean, both because of its size and then also, I think, because of the types of diseases.
There's one thing I want to note regarding to Lyme disease and ticks, something that we discussed with our regional epidemiologist. She emphasizes that for the public to understand that a Lyme disease is transmitted only after a tick has been attached for more than 24 hours. Specific for Lyme disease. The other ones, the babesiosis or those could take less time. But the Lyme disease, which is the one that it has more severe impact, it has to be 24 hours. So that's something I try to remind people to. Some people would say, oh, I found a tick. Oh, does it have a ring? I mean, like the ring will appear days after when the infection has spread through the body, and then the skin is going to have a reaction. So it won't happen like as you have the tick, the ring around and all of that. That happens later. So that's important to keep in mind.
And it's very important that you do not wait for the red ring of disease to show up on your skin. If you have had a tick on your body for more than 24 hours, it is best to go seek care early if you start showing symptoms. Because the sooner that you can catch the infections when they become symptomatic, the less likely you are to have long-term side effects. This is a personal thing for me. My dad got Lyme disease. He didn't notice that he had the red ring. He didn't notice that he got the symptoms as strongly as others might have, and he ended up having long-term side effects for it. So it's a real thing that can cause real problems for real folk. And so be careful out there. My wife actually just found a deer tick on her back the other day, and she said, don't worry. I made sure to remove it properly, and I alcohol swapped the area because I read the article. I didn't tell her to, I promise.
Well, thank you so much. We are going to be doing some tabling education in a series of social media posts. So we will be partnering with Commissioner Sullivan at the canoe races. We're also going to have a booth at the Fisherman's Picnic, and we are also going to go to the open house at the West End for emergency preparedness, August 15th.
Great.
Thank you, Avi. Thank you, Andrea. Great information, great reminder, and great article. So thank you so much for presenting.
Any questions before they take off? Frank has one. Okay, please.
Yeah, thank you. This is my first opportunity to welcome Avi. And my own background is in public health, so I totally respect what you do, and I look forward to working with you and along with the whole board into the future. Great information, absolutely great information. This is what we used to call evergreen information. You create it once, and it's always relevant, but just because we know it, you've told the people here, and I know that you have an outreach campaign to spread that word. I would encourage you to continue as many channels as you possibly can to bring this message to our residents, to our visitors. This is certainly a case where an ounce of prevention is worth many dollars of cure, and an ounce of education can save not only lives and morbidity, but also healthcare dollars. So I think you're doing a great job, and I just encourage you to reach out. Certainly, all the social media, the websites are all great, but there's still a huge section of our community that doesn't regularly follow these things online. So anything you can do, again, create it once, and then it's available for years. I strongly encourage you to do print and posters and inserts and anything that you can to spread that educational material. Thank you very much again for your work.
Thank you, Frank.
Thank you so much, and we will keep that in mind as we continue our prevention efforts when it comes to summer preparedness. Thank you so much.
Have great days.
Thank you.
I'll move on to item 5 is our director reports, starting with staff updates and then also agency updates. Grace.
All right. I'll start with staff updates, and I just want to give you all a word of warning that I have a lot of updates today. There's a lot happening, and so
We're ready for you.
I will pause I'll pause periodically so that you don't get to just hear a big block of me talking, and I'll leave time for comment in between and questions. So I'll start with staffing and HR updates. Marina Fujimoto, our adult mental health case manager, had her last day with PHHS on May 29th. We continue to have the adult mental health case manager position open until filled. Our behavioral health team at the moment is extremely stretched due to being short-staffed. Big thanks to our adult services team and our children's mental health case manager for taking on adult mental health case management clients in the interim. Additionally, Sarah Eisenreich, who was our temporary staff serving as the mobile crisis responder with PHHS, had her last day on June 8th. Moving into related updates for mobile crisis response, starting on June 1st, our mobile crisis response shifted to telehealth rather than in person, with Brightwater taking on 24/7 call. This had previously been Monday through Friday after hours coverage and weekend coverage through Brightwater. The reason for this change is because with our limited staffing in the department, and particularly within our behavioral health team, we simply did not have the capacity to support in-person response within PHHS. Even a slight increase in call volume put us over capacity to respond in person. With the planned move of the mobile crisis response program to First Call for Help and the temporary mobile crisis responder position scheduled to end soon, this decision supports our focus on successfully moving the service to our partners with First Call for Help toward what we hope will become 24/7 in-person response, rather than extending our limited resources to continue the previous program model with in-person Monday through Thursday during business hours. On that note, Cree and Isla, the directors of First Call for Help, are here in Cook County all week. They're meeting with local partners about the transition of the program. I put at all of the spots a flyer for an open house, which is scheduled for tomorrow from 3:30 to 5 at the community center, which is a chance for people to learn more about the program transition, First Call for Help. If folks are interested in learning about what it would mean to be a mobile crisis responder, that's an opportunity for folks to connect with Cree, Isla, and myself while they're here this week. First Call for Help plans to return to Cook County multiple times in the coming months in order to successfully build a locally based program. We will continue within PHHS to facilitate the coordinated crisis response team and support our partners at First Call in building out a successful program. So I think that'll be my first pause before going on. So that's the HR staffing updates and also updates on mobile crisis. Any questions on that before I move on?
Commissioner Campbell.
Thank you, Mr. Chair. I have a question. The turnover that we see, there's so many different things that affect it, and understanding that helps us just to try to, prevent that, or to make sure that we're bringing in people that are equipped to be able to handle the stresses. I would say that there are a lot of people that are drawn to public health human services because of their empathy and their intention of coming alongside and helping people. And sometimes the bookwork and the requirements that are part of the position, they didn't anticipate. So you can take an individual who's profiled to be an excellent accountant, and you can take an individual that's profiled to be very personable. And sometimes those two disciplines that have to exist in one person in public health human services becomes problematic. My question is, as far as Cook County, when you're talking to your peers and you're just looking at the industry overall, how do we compare in that turnover ratio? And if you see that there's something that's a disparity between what's happening elsewhere and what's happening here, then trying to understand that. But if it's just nature of, the nature of the work, then it's something you're constantly dealing with. So that'd be my question.
Sure. Administrator Treble.
So I have one thing to add on that, and then I'd love to hear from our director as well. But when Megan Mose was doing the organizational assessment for us, one of the things that she had mentioned is that the turnover is typically the highest within child protection and behavioral health. And I think that from her perspective, what she had shared is it's because of the nature of the work. It's very challenging, seeing some of the challenges that families and individuals face, and it can lead to a high level or degree of turnover. So just wanted to make sure that I shared that, since that's something that we learned from Megan Mose as she was working with us.
Yes, absolutely. I think that mirrors what we've seen locally. I think one thing that's unique, I do say, I think across the sector there are challenges with turnover. I also think there are some unique factors in Cook County, one of which is just our size. You know, if you're in a larger county with a larger staff and you have a certain percentage of turnover, you still have a certain percentage of people there to pass on the knowledge and experience that they've gathered. And in a smaller county with fewer people on a team, that percentage can be felt much more acutely, just because we have fewer people in our department than you would even in a county like Carleton. And so that's one factor. The next topic in my report was actually considering reorganization, and that does speak to some of your questions about our turnover rates. So I might just keep going with that part of my update, and hopefully that'll speak to it as well.
Can I ask a follow-up?
Yeah, absolutely.
And that would be that for these individuals, are we now conducting exit interviews?
There's always HR conducts exit interviews with individuals when they leave. It's not required, but it's always offered. So we do have information gathering when somebody leaves the agency.
Yeah.
And so we are keeping track of, reasons why people are leaving, and using that as an opportunity for us to learn and reflect on what we can do to improve retention. And that's not just in PHHS, that's
Sure.
across the county.
Yeah, that's good.
So, okay, so one of the other topics in Megan Moe's report was different options for reorganizing PHHS, and that's something that I've been thinking about quite a bit over the past months. And I'm to the point now where I'm gathering feedback from staff while I'm also closely studying those recommendations in Megan Moe's report. And so I've come up with some draft ideas. At this point, it's purely informational. As I say, we're in the information gathering stage where I'm looking at options, talking with staff, collecting feedback. And so I wanted to bring a few points to you all just so that you know where I'm at with thinking about reorganization. This is something that I'll continue to bring to our PHHS board meetings as this process evolves, but I don't want it to feel like it's a surprise at the point that we have in a new position description, for example. I want you to know kind of what my thought process is along the way. So some of the considerations for reorganizing, what are the goals of thinking about this? Ensuring oversight and accountability within our department. I think that's just crucial. Creating a structure that supports staff and aids with retention. That's a key goal of looking at our structure. And also keeping fiscal responsibility at the forefront. In that vein, I will say that the ideas I'm considering right now do not add new positions to the department, and they may reduce the number of positions by looking really closely at 2 to 3 vacancies that have not been filled in over a year within our departments. Some of the positions in my thinking some of them are vacant, some of them are filled, but would shift in their scope and their title to better meet the needs within our departments. So some examples of that. Within social services, the model would include one manager providing oversight across the 3 social service teams: adult services, children family services, and behavioral health. One of the things in Megan Moe's report was the idea of having a career ladder or some opportunities for internal growth within the department. And the way I've been thinking about that is by integrating lead worker roles within the different teams. So a lead worker would be slightly different from a supervisor. They would work under a supervisor or a manager, but their positions would require a greater degree of experience and expertise. They would take the lead on complex projects or cases, and they'd also assist with staff training and mentorship as we bring new staff on board. A few specific positions that would shift in title and scope. One of the public health educator positions would shift to becoming a public health planner position that recognizes the need for assessment and planning as a foundational responsibility within our governmental public health system. The executive administrative assistant role, we're looking at shifting into a systems administrator role that would assist with information management and support for staff in accessing and learning the multiple software systems required in human services. We're looking at the intake function for social services and at centralizing that function in 2 positions that would also spend time engaging in paraprofessional work, such as a case aide, a community health worker, or a peer support specialist, when they're not actively engaged in taking a social service intake. We're also looking at the fiscal supervisor role and shifting that to be a fiscal administrative manager role that also provides backup for the director in the instance that I am absent. And recognizes the key oversight role that this position plays in managing the agency's finances. So I know I myself am a visual person, and I just spoke quite a bit. I'm hoping in July to come again with an update as to where we're at with the reorganization thought process that includes visuals so that it's easier to kind of conceptualize the different changes that we're discussing at this point. But once again, I just want to reiterate that this is an information gathering phase where I'm having conversations with staff as to whether they feel like these ideas would work, whether they feel like they would help us accomplish the goals that I stated initially, and just hearing them out as they're the people doing the work within our department on a day-to-day basis. So that's where I'm at with thinking about reorganization within PHHS. Any questions on that before I move to additional topics? Like I said, it's just a really packed director's report today. Administrator?
Thank you. So thank you for that, Grace, an excellent job. Grace has been partnering with HR and myself in looking at this as well, so I just want to make sure the board is aware of that. And like she said, really pulling in staff to hear their perspectives on these changes and make sure that their voices are part of the process. The other piece I wanted to mention is we're also looking at all of the recommendations that Ms. Mose made in her report and how we can accomplish those recommendations, and that several of these changes are directly related to some of the items that she had mentioned and the things that we need to shift and account for. So I fully support the work that Grace is doing in this area.
Yeah, I just wanted to say that I appreciate the approach, and I greatly appreciate just communicating the ideas and where we are at and where you're looking to go. So thank you for
Absolutely.
that. Commissioner Gamble.
Yeah, thank you, Mr. Chair. Yeah, I couldn't agree more with the comments and the affirmation. I mean, we've gone through quite the process in public health human services, and I keep referring to it as an example that could be a case study. This is how you do it. When there's an identified challenge, problem, however you want to term that, what is your response to that? First is to identify and then to take a look. We brought somebody in that made recommendations, and that was my initial question, is how are we connecting that investment in evaluation to direction? We've had some discussions, I'm sure it exists elsewhere, with our advisory committee. And sometimes we find ourselves in a situation where our experience reshapes how we are going to formulate what we do. And there's a healthy way in which that happens, and there's an unhealthy way where we're accommodating something And we don't want to be in that position. We want to take what we're learning, what we've gathered through the advisory, what we're hearing from staff, from our human resource, administrative position, and all of this collective with identifying what our goals are, as you have mentioned. It's a healthy process, and it just really encourage the direction that we're going. It's healthy to be able to step back and say, are we doing the best that we can do? And we had Northern Counties, we had a presentation from St. Louis County and their GIS department this past week, and they had a logo thing is like a star you'd see on Blue Ribbon Meats or whatever. It had that kind of look, but what it says, be the best you can be. And when they made their presentation, the first thing they said, this is our direction. And we hear those words, but the substance of those words demonstrated what they presented. It just blew me away. And so I encourage you focusing on the things that what you want to be and what you want to deliver in services to our community. How can we best do that? And having all those collective voice and the advice that we're getting, from the consultant, things like that, that we're connecting the dots on that. It's just great. So I continue to be affirming what we're doing in the department. I appreciate your leadership in that.
Well, thank you, Commissioner Gamble. Like I said, this is not the last time you'll hear about reorganization efforts, but I wanted to get the conversation started. Okay.
And the main thing is coming from the right place.
Absolutely.
Yeah, the direction that we're going is coming from the right place, and it's not motive because we have to adapt to something we can't figure out. So I think having Megan Moe's report and expertise, and really having the ability to continue to consult with her in that kind of coaching relationship has been really helpful. So I've shared these ideas with her as well and gotten her feedback on them. So I think that trying to use all the information that we've gathered and gather feedback from our HR department, our administrator, and our staff within PHHS, those are all important pieces of the puzzle as we figure out how to move forward. So, okay, I have public health updates. So Rocio Rivas, our youth prevention specialist, is working with various youth groups over the summer on a multimedia project with Bear Witness Media. You'll see later on the agenda, there's an item that is related to the contract with Bear Witness. The intent of the project is to engage youth in media production while creating conversations about mental health, connection, and resilience. They're also aiming to create something authentic, positive, and inspiring while showing how youth can make a difference in their community. Andrea Orest was working with Sarah Waddle, our community center director and extension educator, to co-facilitate the COMET training, which is changing our mental and emotional trajectory. They both trained as trainers this past spring and co-facilitated a training at Cook County Higher Ed last Friday. It's a 2-hour interactive training that teaches community members how to reach out in a meaningful, respectful, and supportive way to friends, neighbors, and colleagues in a time of need. My next update is from the Thrive Together Community Resource Directory website project. You may have seen the media release that the county put out last week. The Thrive Together website is live. There's also going to be a County Connections article coming out on Friday talking about the resource directory, along with an outreach campaign that happens over the course of the next several months that includes social media, spots on radio, on Boreal, and then also a mailer with a magnet to households throughout the county. That'll come in the late summer, early fall. But we're really just trying to get the word out to let people know that this resource directory is out there, and it is a tool for all people to learn to learn what services are available in Cook County and to connect with those resources. So it can be used by professional colleagues helping clients. It can also be used by anyone who is looking to know what's available in our community. The URL is thriveccmn.org. That'll be in the notes as well, but highly encourage you to take a look at the site, spend some time exploring, and
let people know. I mean, I think the resource is really only going to be as good as it is utilized across the community. So at this point, what we're looking for is to really spread the word. I'm also planning to go on the radio tomorrow morning to talk a little bit more about the resource directory site. Huge thanks to Betsy Blaisdell, who's one of our office support specialist case aides, who did a tremendous amount of work in putting together and organizing the resources in the site. To Erica Turns, who is maintaining the site over time, and to Danielle, our PIO communications specialist, who has also played a really key role in communicating with our vendor, helping coordinate submissions from local photographers, and bringing us all together to make updates over time. Our advisory councils. So we had a joint meeting of our local mental health advisory council and our public health and human services advisory council last Tuesday. We discussed a draft mission vision statement for a merged advisory council and reviewed the statutory requirements for PHHS advisory councils and local mental health advisory councils. Andrea Orest is going to be leading a work group to ensure that as we discuss merging, there still remains a focused effort to recognize mental health and mental health supports in the community. We're going to be meeting again on Tuesday, July 14th at 1 p.m. to continue to discuss mission, vision, bylaws for a merged group. At the point that those are complete, we will have a vote to formally merge. I'm not sure if that will happen in July or August. It depends on the evolving conversation. We're also, we every year have a grant making process that is facilitated by public health supervisor and includes a subcommittee of the Public Health and Human Services Advisory Council. That's the Public Health Fund Subcommittee. And we're going to be reaching out to 2025 grantees for their annual reports and getting that subcommittee back together to prepare for 2027 grant making. So more to come in the following months about that. Any questions on public health updates, the Thrive Together website, or our advisory councils? And then I'll move us into my last topic.
What's the last topic?
SNAP updates.
Okay.
Please, Commissioner
Just wanted to know the weight
Yeah.
or whatever. I did have a question. I'm not sure if you can answer it or not, but in the financial report that we had in our packet, when we look at the mental health services under the collections, that's significant. Can you give us a context to understand that 269% increase in collections?
Yes, I believe that's related to a state recovery case that our fiscal supervisor had been working on that came to a close in 2026. So
Okay.
that is the reason for that increase.
Yeah. And sometimes, I mean, when we're looking at budget for the county, departmentally, whatever, that there are revenues that come in and it's not finite as far as tracking things at an immediate level, but that's something that's out of the ordinary, given
Yes.
the nature of what we were doing. And
Absolutely.
Yeah, and I appreciated Plumit's work on that. That's
Yes,
huge.
I echo that. He's been doing phenomenal work with
Yeah,
a state
yeah.
recovery.
Thank you.
Yep. All right, so changes to SNAP. I'm going to do my best to be clear and succinct here because it's a big topic. So last summer, this board will remember that I did a presentation on House Resolution 1. It's also entitled the One Big Beautiful Bill Act. This is federal legislation that affects state and local government. There are changes in this bill related to both Medicaid and SNAP, and they don't happen all at once. You might remember from last year's presentation, they happen on a rolling basis over the course of several years. So I want to talk about specifically what changes in HR 1 are related to SNAP. So there's many policy changes that affect SNAP, and those include changing how benefits are calculated, narrowing eligibility for legal non-citizens, expanding work requirements for more groups, and shifting more costs onto state and local governments. And that last point is the one that I'm going to focus on today. So SNAP, just a reminder, SNAP is what the acronym for the Supplemental Nutrition Assistance Program. This is a program that serves around 212 people in Cook County. The average benefit amount for a SNAP recipient nationally is around $6 a day for food support. And there is an economic impact in the estimate that each dollar spent on SNAP benefits generates around $1.50 in local economic activity. And that's because making purchases in local grocery stores, that creates jobs, that creates additional spending in the economy. That is how that $1 spent, $1.50 in local economic activity. That's basically what that represents, and that's a national calculation. So that's SNAP in a very small nutshell. So the cost shifts. There's a portion of these cost shifts that will go into effect October 1st, 2026. We weren't sure exactly what this was going to look like until after the last state legislative session, which is why the update is coming now. We knew something would change in October, but now we have a clearer sense of what exactly that will be. So with SNAP, the federal government reimburses us 50% of the cost to administer the SNAP program. So we have staff within the county that administer the SNAP program on behalf of citizens participating in the program. And to date, the costs have been reimbursed at a rate of 50%. But with this change in legislation, that reimbursement rate will drop from 50% to 25%. So rather than the county paying that 50% administrative cost share, the county will now pay 75% of the administrative costs of working with the SNAP program. There's an additional change that's slotted to occur 1 year in the future, so that's October 2027. And that cost share is related to benefits. So I'm going to try to, again, be very clear, but it's a little bit, it's a little bit complex. So every state has what's called a payment error rate for SNAP. That can be an overpayment, that can be an underpayment, it can be something that a staff member miscalculated. It could also be something that the client misrepresented or omitted in an application. But all of those errors are corrected, but they're also reported into state and federal systems. So every state has a payment error rate. And based on what that percentage is, the payment error rate at the state level, state and local governments will be required to pay a percentage of the SNAP benefits. So to date, the federal government has paid the entire cost of the benefits that individuals participating in SNAP receive. But with this new legislation, depending on what the state's payment error rate is, there will be a cost burden shifted to state and local government. So our current payment error rate at the state level is 8.9%. It's lower than the national average, which is 10.9%. But at that 8.9%, state and local governments would be required to pay 10% of the SNAP benefit costs, which were previously paid for by the federal government. So AMC and MAXA have done some cost estimates, and I'm going to include the AMC handout with my notes so that you all can see exactly kind of what I'm referencing, but I thought it would be helpful to verbally give you kind of the general sense of what these changes are, but they've done some projections on what these costs will mean by county. So the administrative cost share, the estimate for Cook County for 2027 on that, instead of getting 50% reimbursed, getting 25% reimbursed, the total cost increase to Cook County for administrative costs with SNAP was projected to be $76,994 for the administrative cost share associated with HR 1 for Cook County. So that's cost that was previously being reimbursed by the federal government but with this change in legislation, will no longer be reimbursed by the federal government. So that's 2027 administrative costs with SNAP. And then, let's see. So actually, I misspoke. That's the administrative cost share, and it includes the 10% benefit cost share. So that's the MAXA AMC estimate, that the increased administrative cost share with SNAP and the 10% benefit cost share, the total increase to Cook County for 2027 is projected to be approximately $76,994. In the last state legislative session, Minnesota passed a one-time appropriation to counties to offset cost shifts to the counties associated with HR 1. So the estimate for Cook County with this one-time appropriation is $30,875. So the difference is roughly $46,000 in a cost increase to Cook County that would not be covered by that one-time state appropriation. So it's a little bit complicated, but I did my best to explain. I'm happy to welcome questions. AMC and MAXA also have some key messages for local elected officials and local leaders to remember. One of the things is that there's a push to delay implementation. That would be a federal push. That's something that AMC is discussing. Talking about Minnesota is somewhat unique. We're one of only 3 states in the country in which counties pay a portion of the administrative cost for SNAP. So there are other models in other states, and our state is somewhat unique. There is a sense that these federal cost shifts will create an ongoing financial burden for counties, the way that the legislation is written right now. The one-time funding is helpful, but again, this is a long-term policy shift, so this is a long-term cost shift that we're looking at. It is worth noting that counties and states are partnering to improve that payment error rate, which would reduce the benefit share in the future. And there were upgrades to technological systems and investments in the last state legislative session, but these don't happen overnight. Modernizing technological systems takes time. And I think just to end on a positive note, AMC and MAXA continue to be very committed to SNAP. It is a very important program. It does reduce hunger. It does support local economies. However, this change in legislation does create a change in cost burden for counties, and that is something that we have a better sense of after the last state legislative session. So I will include that resource in the minutes from this meeting, and I'm happy to take questions from the board now or in the future as we consider what this will look like for Cook County.
Do you know what the next tier is for the error rates, and what percentage would be a cost share at that next lower? I'm assuming you're reducing
let me
error
pull
rates.
that up right now.
And if it's not easy or there, that's fine, but that's an initial question I had. And then also just for our perspective, a little bit less for this first year, but it sounds like in the upcoming year, that's roughly a 0.5% of our levy.
Yeah.
Just to give us some perspective there. The last number I had heard, and I shared with Grace, was something around 26,000 total, so this is a significant increase from that. But
So
could be a lot worse as well.
the payment error rate, right now we're in the 8 to 10% range.
Mhm.
That's the 10% benefit cost share.
Mhm.
The 6 to 8% payment error rate is 5% benefit cost share.
Okay.
And then if there is less than a 6% payment error rate, there's a 0% cost share for the benefits.
Do you know, I'm assuming fraud is included in the error rate. Is that a
Gosh,
safe assumption?
I know, I know that fraud and SNAP in particular, the rates are very low. I'd have to look into the research to give you an exact quote for, what is the research on fraud in the SNAP program. I'm not sure if I can answer that question fully, but I know it includes overpayments, underpayments, worker error, client error. That's generally kind of what the payment error rate captures. So, yeah, and the timeline for these changes and more detail is in that AMC handout. I just wanted to give you some context because if you look at it, at first glance, it has quite a bit of information, but that is the background. This is coming out of HR1, and this is part of that kind of rolling implementation of policy changes that are included in that bill. So,
Thank you. Commissioner Gamble?
Thank you, Mr. Chair. So, just to be clear, then, we were being reimbursed for the administrative costs at 50%, but now that's changed, so it's going to be 75%.
we'll be reimbursed at 25%
I mean, 25%,
and responsible for
which means now we're going to have
75%.
to.
Correct.
Yeah.
And that's in
then-
October.
And then we have, because of our error rate, we're at a 10% of having to pay the benefit. And that combined is roughly about 76,000, but because the state has a one-time appropriation, it'll bring it into 40-some thousand. So when we're looking at the budget, we're going to be $40,000 more, realizing that whatever our numbers were in 2025, 2024, that there's going to be a variable with changing numbers of participants, but there's also, because of the HR1, going to be the additional 40-some thousand that we'll be looking at in the budget.
Yes, and when we do our budget presentation, I'll make sure that Plowman and I are clearly pointing out where this applies in our budget for 2027, because again, it's still kind of a rolling implementation. We have a piece in effect October 2026. The bigger piece, which is the benefit share, won't go into effect until October 2027. So both of those points in time will be taken into effect as we create our budget for 2027.
Yeah. We have, following this meeting, we'll be having our committee of the whole, and soil and water will be presenting, and we can see the effects of legislation as it impacts revenues and how we have to adjust accordingly when we've got less to do, increasingly more, so to speak. So appreciate the information and
Yeah.
keeping us aware.
Yeah, absolutely. And like I said, feel free to ask questions anytime.
Any other questions, Grace? Okay.
That's the last item in my director's report. Thanks for sticking with me there.
Thank you for communicating. Oh, Frank, did you have anything? I'm sorry, I didn't look at the screen. Okay. All right, we'll move on to items for board action, just the one, and this is the contract for the youth engagement project that Grace had mentioned. Anything more you want to say there, Grace, or do we have any questions about that?
I'll just add that that is entirely funded through the Substance Misuse and Suicide Prevention Grant, and it's included in our work plan for that grant.
Great. Commissioner Sullivan.
Thank you, Mr. Chair. Grace, a question, as youth are participating in this endeavor, is PHHS the one that's in charge of releases, permissions, and that type of thing?
Yes, so we have all of those forms created, and we are the ones taking the lead on that portion.
All right, thank you.
Mhm.
Mr. Chair,
Commissioner
we're
Gamble?
looking for a motion to support the Public Health Human Services Youth Engagement Video Project Production contract, which is fully funded through the Minnesota Department of Health.
Thank you, Commissioner Gamble. We have a motion. Is there support? Commissioner White?
I'll support
Thank you. We have a motion from Commissioner Gamble, support from Commissioner White. Further discussion? Hearing or saying none, all those in favor?
Aye.
Aye. Those opposed?
We need a roll call since he's virtual as well.
Ah, touche, touche. We'll do a roll call vote. Frank?
I vote aye.
Thank you. Commissioner Sullivan?
Aye.
Commissioner Gamble?
Aye.
Commissioner Mills is aye. Commissioner White?
Aye.
Commissioner Starley?
Aye.
We have our unanimous vote. Thank you very much. That moves us down to, I'm sorry?
Aye.
Boy,
Can I add one thing before?
Yes, please.
I just got a message that Sawtooth Mountain Clinic is indeed receiving ticks. So if you have
Oh.
a tick and you want to bring it, I mean,
Oh, yeah, we got
usually you
bags at
put
home.
it
Bags
in
and bags,
tape. But if you want to drop off a tick at the clinic, they do pass them on to Grand Portage, and then Grand Portage screens them to see if they're carrying any diseases, which is actually a really important source of
Oh,
local
yeah.
data as to what our tick population is carrying.
Incredible local information, and it also relates to our wildlife, moose,
Exactly.
deer,
Yeah.
all things. But, yeah, Commissioner
Well,
White,
but
yeah.
that means we have to forego the pleasure of smashing it between two rocks or
Yep.
starting it
Yep.
on fire. What other,
I mean, if you find enough
Different types
ticks,
of pleasure,
there could
though.
be
There is.
enough for both things, right? If you
Yep.
could bring some to the clinic and then dispose
Well,
of others in different
Well, they
ways.
don't have to be alive, so you
I
can
know,
smash
but
it and then bag it, you
yeah,
know?
but they're pretty like all over.
Yeah, there's ways. Okay, let's move on to committee reports. We have a little bit of time here, so that's nice. The first one is the Active Living Steering Committee. Commissioner White.
Well, and I talked about that last time a little bit. A lot of it has to do with trail development up by the view. Is that what it's called? Up on the hill, and doing that. And Robbie has many details on that. So it's going to be. The question is, do we do at some point a bridge or a tunnel
Oh.
under the Gunflint Trail? Because you absolutely cannot ask a loaded semi to slow down or going either way. So that was interesting, but
And for the trail, it's gonna go from the highway to the recycle center. That won't need a bridge or a
No.
tunnel.
No,
right?
no, no, no,
And
no.
that's this year yet, right? Is it?
Correct.
Yeah,
Yes.
yeah.
yeah.
Good deal. Thank you. Next one is AEOA, Commissioner White.
They have a meeting tomorrow, and I am tomorrow,
Okay.
and it can be Zoomed, and I did send out a request. Can somebody take that Zoom meeting?
Oh,
It's,
I betcha I'm the alternate, and I betcha I can take that Zoom meeting.
what's tomorrow. Tomorrow is our
Yes,
AMC in the
Oh,
morning.
in the
yeah,
morning,
thank
and this
you.
starts at noon. The Zoom meeting's, no way, I just had it in my brain.
I think we're done it.
Just
We
send
were
them
done
a-
by noon.
Send them a notice, explain why.
And because it's still hanging out there, our bill or their invoice to us about helping to support
Oh.
their
yeah, for the new
construction, and we
building.
have not come up with an answer for that yet.
I'll
But
need
I
a
would like to
reminder.
report about the AEOA buses, which has to do with that. They actually do not have a hard and fast rule about the 5-mile limit, because they actually delivered 3 miles off the highway to our doorstep. A person just getting out of the hospital, and they just said, yeah, I mean, it was the Grand Portage bus that it worked out in,
Yeah.
and the bus has no shocks,
Oh,
just so you know.
yeah, heard of that.
So that was really, really a nice, individually, and it was a nice gesture to do that.
Yeah, absolutely. Well, it's encouraging for other options as well.
And I do know that there have been other instances where people have needed to be on the 5-mile limit, but and maybe only by half a mile.
Sure.
And so they were able to get to Grand Marais to the hospital, so.
Excellent. The next item is Arrowhead Health Alliance, also Commissioner White.
Oh, I just attended that meeting, and they're doing quite well. They're positioning themselves for the eventual retirement of their administrator, who's been there
Rick?
forever. But it might be 2 years or 3 years, but just in case he drops dead from something, they're getting, quote unquote, he looks to be in good health.
Yeah.
That their finances and their different grant sources are covering everything that they need at this point. So it's a healthy organization focusing on mental health and behavioral health, and before being in this position. One, I never thought about how mentally ill everybody in this world is. I mean, but two, the number of resources, I mean, even locally, it's almost overwhelming. Maybe it's not enough, but it's very comforting. Just like emergency services is very comforting in this county. So, way to go, Cook County.
Thank you. Arrowhead Regional Corrections, Commissioner Gamble.
It's been moved up to Thursday because Friday is Juneteenth, so we'll be meeting Thursday.
Community Health Board, we did meet. Our doctor's report this time was on measles and Ebola, and very stark. So far, the United States has more measles cases than all of last year. It has not been officially, I mean, maybe it has by now, but it has not been officially considered endemic, or I forget what the term is, Frank, I'm sure you know, just about having that there's like zero.
Immunity.
So there's a designation that a country can get that says that they have eliminated measles. So we
Right.
have that designation, and we will lose that designation. We haven't lost
Not
it
till after
yet,
November, though, I think.
but
right?
it's projected that we will lose that designation within the year due to the increased activity of measles
Yeah.
in the U.S.
I'm not a betting man, but I bet it'll be after November that we we lose that designation. And then, the Ebola statistics were also just incredibly shocking. I believe it's a 30 to 50% mortality rate. And then we had a graph showing the previous outbreaks, the historic outbreaks, and this one. And it was a graph over 100 days. And they were, had a decent slope to them, but this outbreak is almost just straight up. And I believe the numbers are greater than all of the other outbreaks combined, and just going up. There have been American doctors that have been denied re-entry into the United States, and also treatments have been denied from the United States to the Congo. And so we have American doctors out there just hanging out without coverage from our country or the support from our country. And that was just really, really terrible. So that really gives pause to other doctors to, provide services as well, because if they're going to be put in that same situation, it just is really tough. So very, very discouraging. Also, and there was one other disease too that he covered, and I wish I remembered what it was now, but it was disturbing because all three of the diseases, the symptoms start out as like headache, body aches, dizzy, like all very common viral symptoms. And so the other one was hantavirus. And that one was also very scary. I'm sorry, maybe that has the 30 to 50% mortality. Anyways, all of them start out with those kind of vague, I'm not feeling well. And, it's just really hard to, it could be COVID, it's just hard to know what's going on and if you should go in and when you should go in. And of course, our risk for Ebola or hantavirus in Cook County is very, very slim in Minnesota. But it's just interesting. This is the first hantavirus or it's the only hantavirus, I guess, that allows from human to human spread. And that originated, I think, in Argentina, an Argentinian cruise, and I think there was 23 different people from 23 different countries on that cruise, and then they were not, I think there was one death and then maybe a second death of the spouse of the initial one, but they were not quarantined once they were landed. It was just like, okay, there you go, everybody. And so contact tracing then has been a bear. And I did read some update in the news that we do have a person in the United States that is still under quarantine. They'll pass the CDC's recommendation, but I guess just to play it extra safer, I don't know what's going there. But it's very, very scary. Commissioner White.
Do we have an approved or intervention to help people not die and then to prevent them from, do they develop antibodies to it so they do not get reinfected?
Are you speaking about hantavirus
Yeah.
specifically? So
There's not a vaccine. If
Yeah.
that's if that's
Yeah.
I will say something that is challenging is hearing about something like Ebola or hantavirus. And there are not, at this point, confirmed cases within the U.S., but whenever there's an outbreak like this anywhere in the world, the whole public health system goes on alert. And at the state level, at the regional level, like, staff get updates and can push updates to clinical partners about different disease outbreaks. The global public health system is not as robust as it was even a few years ago during COVID, and that is a challenge because there is some interconnectedness between our local and state health system and global health systems that monitor these types of outbreaks. But, we continue to do the best we can with the information that we have, and like I said, share that information with clinical partners. And the point at which we're talking about medication interventions or vaccines, that typically those messages get pushed out to healthcare providers along with what questions to ask about travel history and what symptoms to look out for based on the answers that someone gives. So it's not exactly an answer to your question, but there is this system, and it went into effect at the beginning of COVID. And, it goes into effect every time something like this happens somewhere in the world, that everyone learns the basics of the disease, what to look for, how spread is occurring, what the characteristics of that spread are. And so it's, even though we don't have cases, Andrea, who is just here as our preparedness coordinator, she's also our disease prevention and control coordinator. So she sits in on those meetings regularly to learn what the situation is, even if it appears to be a very low risk, because we know that those situations can change. We're not anticipating that with any of these outbreaks, but it's still best practice to remain informed.
Frank had a question or comment?
Yeah, just a comment, Commissioner. Hold on one sec. With regard to hantavirus, that is endemic to the Southwest, carried mainly by rodent droppings, but that is present in the U.S. Ebola, of course, is not, and first line of defense there is simply going to be surveillance, spot cases as they come in. The big elephant in the room is measles. Extremely contagious, reaching the point, accelerating toward the point where herd immunity is no longer effective. And and there is a vaccine easily available, but we all know the history of that.
Thank you. Yeah, the contagious, how contagious they are was also an interesting thing. Measles, crazy contagious. Ebola, not as contagious, but way more deadly. And then hantavirus. Yeah, I've been aware of hantavirus just from my rustic life and being aware of rodent droppings and that, but haven't heard of anyone. And then just that human-to-human spread is I thought, kind of the twist on this particular strain. So, But, yeah, so that was very informative and eye-opening. Let's move on to the local advisory council for mental health. Rana's not here. Grace gave a update, so maybe we can just pass on that. Council on Aging, Commissioner White.
Just more of the same. They continue to seek grant dollars, and they will be coming. They want to do another presentation to the board with the administrators when it would best work out for doing our budget.
Okay.
Commissioner Sullivan, Emergency Preparedness.
We did meet last week and primarily had Warren LaPlante from Lake County do an after-action discussion with us about the fire, the Stewart River fire in Lake County. And as I've said before, if you drive along Highway 61 from Two Harbors towards Grand Marais, towards Cook County, that is the best advertisement for Firewise we will ever see. It's very unfortunate and very sad, but please follow our Firewise principles and seek support from Firewise if you need it. Thank you.
Thank you. Any updates from NACO you'd like to share, Commissioner Sterling?
Just basically working on the Medicaid part and the responsibility that's coming onto the counties, eligibility and how do you enforce it. So continuing with other people in other states, how they're going to help us do it too. So.
Thank you. Anything from JET, Commissioner Gamble? Nope. North Shore Collaborative, I did not, I think we'll pass on that one. Either I already updated it or there isn't a whole lot to update there, just that we're spending down our reserve and the funds are not coming in like they used to, so that's kind of the strategy there. Also had an update regarding our PHHS Advisory Council from Grace, so could probably pass on that. And then the Food Access Council, a lot to update there. A lot of good coordination, and the most exciting thing in my mind is there's been funding received, a grant for the leftovers from the farmer's market to be purchased and then given to the food shelf. And I just think that is fantastic and such a good step and that type of thing. And then also hearing updates on the Food is Medicine prescription pilot. Just that's developing and moving forward. And I think it's been a while now, I guess. Couple weeks, but the last I had heard there were 6 people signed up out of I think the 11 they're aiming for, so maybe there's more by now, I don't know, but I think that's a really great program that hopefully will be helping people. I also was hoping we could make connections just with our in-home supports, because part of the challenge too can just be, it's one thing for people to get this fresh healthy food, it's another thing to prepare it, cook it, so. And there is support for that too. So I'm hoping all of these things can align and we'll be doing some real good there. But anything else for the good of the order?
Oh, Frank's got something.
Oh, Frank, sorry, you're on.
The 6 out of the,
Go ahead.
The 6 out of the 11, I'm sorry, was that for members of the Food Access Council? They were looking for 11 members and you have 6 signed up so far?
No, that was the Food is Medicine RX, the prescription
Food is
program.
medicine.
Yeah,
Okay. Okay, thank you.
Yep.
And with regard to the advisory council, Grace gave an excellent summary of the process of merging the Public Health and Human Services Advisory Council with the Mental Health Advisory Council, and I fully support that. And I think it's going to go a great way toward using the volunteer resources that we have more effectively, and just give fully support to this effort.
Thank you.
Thank you.
Great to hear. All right. Well, not seeing anyone else chomping at the bit to speak, so I'll call us adjourned. Thank you.
Thank you.
David, I forwarded the
Oh, the
email
link.
from Jessica Zolar.
Thank you. I think I should be able to, well, we'll see how our Wednesday goes, I guess.
Right, and I don't have enough
Oh, right.
energy to.
Yep.
But I am going to be at the thing Wednesday morning.
Yeah, I forgot about that.
Okay,
so.
I'll tell Andrea.
Well, normally I was like, it should work, right? It should work.